the center of the body.
Okay.
Okay. So we're not talking about the heart or the brain. We're talking about the limbs. And the area that this affects most often are the legs. Okay. Arteries are the blood vessels that carry blood flow to the legs, and then it's a disease process. Okay. Peripheral artery disease involves plaque building up inside arteries.
Okay.
And plaque is a term that most people seem to have heard somewhere, either on media or talking with their doctor. What it means is fatty deposits that build up inside the arteries. And when that happens, it narrows down the artery, slows the blood flow, and can cause a lot of problems in the legs.
So let's talk about some of those problems. What are the results? Is it kind of silent, or is there a red flag symptom?
Well, there is a red flag symptom, but it's interesting. People misinterpret it. So as the blood flow is slowed down to the muscles can cramp.
Okay.
And just like when there's heart disease and people get chest pain with exercising, there's a lot of awareness that that's a red flag. That means see a cardiologist. Okay. But there's not so much out in the public right now telling them that when they get cramping in their legs, that may also be a vascular problem. So just like a heart attack or angina causes chest pain, you can have a heart attack or angina in your leg. They're both muscles. The difference with the legs is you can stop and rest.
Okay.
You can't stop your heart and rest it. So with the legs, someone will walk a certain distance and the muscle doesn't get enough blood flow to continue being active, and it starts cramping. And then the person having those symptoms, they stop.
Okay.
And they rest a little bit, and then they feel like they can walk farther. What makes it a little bit more under the radar, if you will, is that as people get older, they start thinking that's normal. And they think, oh, it's just arthritis, or, it's just my age.
So some people brush it off.
Exactly.
Okay.
Brush it off. They don't see it as something of any particular concern, and it can progress. It can get much worse.
Let's talk a little bit about that. Obviously, we wouldn't ever want anyone to have it go from bad to worse. But worst case scenario, someone begins to ignore these symptoms, or they think, I'm just old, I'm just tired, or whatever the case may be, and they do ignore it. What's the progression?
The common story I hear when I talk to my patients about this is, yes, they first started noticing they couldn't walk as far, and after a while, they just stopped walking at all. They quit going to the store. They started noticing anything walking outside of their house was painful. As that gets worse, it can result in pain at rest. And the interesting thing about that is gravity actually helps our blood flow down our legs.
Okay.
When arteries are narrowed or blocked, then putting the legs up takes away that benefit, takes away the gravity benefit. So a very common thing with severe PAD is cramping in the legs at night.
Okay.
Laying in bed, the legs are up, gravity's not helping, and people find their own solution to this. And it's interesting how we do that, how we live with something and we figure out how to get by with it.
So is it just like people will take like a pain pill, like something to maybe help ease the pain for a minute? Sometimes,
but the common thing that they figure out is that sitting up or standing makes it better. And I ask them, what do you do when that's happening and when that wakes you up? Well, I sit on the edge of the bed for a while and it gets better. Some people will sleep with one leg literally hanging off the side of the bed because gravity helps. And in the really severe cases, they quit sleeping in bed. They'll sleep sitting up in a chair or in a recliner. Yeah.
Well, at this moment, we would like to invite all of you out there in a Facebook world, all of you who are watching us, now that you've heard just a little bit about what PAD is. If this sounds familiar to you, or if this sounds familiar to maybe someone you know, here's what we want you to do. Get onto 23ABC Facebook. Send us your questions, your comments, your concerns. Dr. Isaeff is going to be taking those questions and answering anything that you might have to ask regarding PAD, or maybe if you have a question, some general symptoms, and you're not quite sure what it is. Obviously, doctor can't treat you from here, but maybe he can give you some information that might help you possibly understand that it could possibly be PAD. Doctor, I want to ask you something. Is there, here in Kern County, we have a very large population of Hispanics. Does PAD affect Hispanics more than any other group, or is it just fair with everyone?
It's really fair with everyone.
Okay.
The biggest risk factors that we can do something about are lifestyle issues.
Okay.
Okay. So if any particular group of the population has more of those risk factors involved in their lifestyle, they are much more likely to develop PAD. And those things are issues like smoking. Okay. Smoking is a huge one. And then medical problems that go untreated. So having poor access to health care is a major problem. That person may have high blood pressure, diabetes, high cholesterol. When all of those things go untreated, it makes the artery disease worse, and they're much more likely to develop those problems.
What about the eating habits? Is it a high fatty food diet that can also contribute to this?
Exactly, and the bad fats, high cholesterol foods in particular, and that causes more of these fatty deposits inside the artery. And there's also an inflammatory process involved. Those deposits start irritating the artery, and they're learning a lot more about this inflammation process. Part of the reason they say take aspirin with vascular disease is aspirin's an anti-inflammatory and can actually help slow that down.
You kind of touched on one of the topics that I wanted to talk a little bit about. You've mentioned a lot about sort of what happens to the body internally, but you just touched on inflammation. Are there any visible signs on outside, like on your legs, that you might actually see? Like, is there any color discoloration or anything like that?
Absolutely.
Okay.
Some of these are when the disease is particularly severe, but one of the early changes someone might notice is that one leg is colder than the other one. Now, there's a lot of people, including young people, who just have cold hands, cold feet, you know, particularly in cold weather. We're not talking so much about that. We're talking one leg that feels different from the other one because the one leg has vascular disease, the other one doesn't. And it can cause discoloration. In severe situations, the leg can be discolored. It can be dark, it can be bluish, and have problems like that. People may notice that their toenails just don't grow. The toenails are a part of the body. You know, we can look at them, we cut them regularly, but you may not pay attention to that, but if they're not growing and they're very thick, that can be a sign of PAD, and that's when you really don't hear anybody talk about very much.
So let's talk a little bit about how it's evaluated. If someone's out there listening and, you know, they have all those little check marks going off in their mind saying, yeah, I've been suffering from this, this, and that. How is it evaluated? What do they need to do?
Well, start with your primary care physician.
Okay.
That's an important place to start. And also, as a side point, many insurances require that. Some don't. Sometimes you can directly go to a specialist. And so that may be available for some in our audience. But you talk with your primary care physician, and then you discuss with them referral to a specialist. A vascular specialist.
Okay.
I'm a specialist called a vascular and interventional radiologist, and within my specialty actually was developed the techniques and ability to study blood vessels and treat blood vessels. So that's my background. There are other type of specialists as well. And so that would be the thing to discuss with the primary care physician and talk about getting to the person who specializes in blood flow, specializes in that area, and see what can be done.
So let's talk about what can be done. In your experience, obviously, it can be someone who it was barely diagnosed to the more extreme cases. What is the range of treatments that you offer?
Sure. Well, it all starts with an office visit.
Okay.
So just like you go and see your family doctor, you know, if this person were seeing me, you'd come to my office, we'd sit down and we'd talk. We'd have a chat about what's going on, how long it's been happening, get more detail, more information about it. And it's interesting how obvious it becomes just from that conversation whether the problem is likely to be vascular or not. If the signs are pointing towards that, and the examination, including checking the pulses, are confirming it, we go to some additional testing. Testing that is completely non-invasive. And what I mean by that, in very simple terms, is it doesn't hurt.
Okay. That's always good.
Things like ultrasound that can directly measure blood flow.
Okay.
It can find narrowed spots in the arteries. And the legs are a great place to use ultrasound because you can see things very well in the legs, and you can see those arteries from the top all the way down to the feet. And so that testing really provides a lot of additional information to really zero in on where the problem is, and is what we're seeing on a test fitting with what the patient's experiencing.
Then what happens afterward, after you have that initial conversation and you have a better idea of what's happening with that person? What next?
Yeah. Well, I call it putting all your ducks in a row.
Okay.
So you're building your information, being certain of what the problem is. And in this day and age, rather than jumping to surgery, we go to a procedure called angiography.
Okay.
And angiography is what I was alluding to that started within my specialty. It started in the mid-1900s, so it's not that old of a technology, but it's advanced rapidly, particularly in the last couple of decades. Everybody probably knows or maybe has had a relative who's had an angiogram.
Yes.
And sometimes the term cardiac cath is used because so frequently this relates to placing a catheter in an artery in the leg and studying the heart. But the same techniques are used to study blood vessels all over the body. And that's what we do for the legs. We use that catheter to inject an X-ray dye, so it shows up on X-ray pictures. We have a special room that looks a lot like an operating room, but is much less intimidating. We don't need an anesthesiologist. We perform what's called conscious sedation, meaning someone is asleep, deeply asleep, but we're able to wake them up. Okay. And that way they're comfortable. Time passes, usually not even aware that time has passed. Sometimes at the end they'll say, when are you going to start, Doc?
Oh, okay.
But
and it's already over.
Yeah, but we pride ourselves in keeping all our patients very comfortable. And then the angiogram shows us the artery. It shows us the inside and whether or not it's become narrowed, and sets us up then for treatment.
After treatment, after someone goes in for treatment, what is the recovery like? Is someone going to have to stay off their feet for a while, or can they go back to work the next day? What are the different scenarios?
Yeah. Well, we call this minimally invasive. Okay. So obviously it is a procedure. It's done through a tiny little nick in the skin. Doesn't require any sutures. Heals quickly. And then the treatments that are done are all through the catheters. Okay. So minimally invasive in that we're not making a long incision, we're not operating. Everything we're doing, we're seeing with X-ray. And we may perform angioplasty using a balloon to stretch open an artery. We may place a stent that stays there and holds open a problem area in the artery. Okay, and then we have some very advanced techniques. But since it's all done through a small little tube, the recovery time is really very fast. And we have all our patients avoid strenuous activity for 2 days. I tell them all, you can go ahead and be out of the house the next day. You can go shopping. Other than a 24-hour period after sedation, we don't want people driving. We don't want them getting a DWI. But other than that, they can start doing things the next day, just no strenuous activity for 2 days. And then I encourage them, try out your legs. See if you don't feel better, and walk farther and notice a real difference.
Doctor, words like stent, it could trigger, it could evoke thoughts of, something more dangerous because of the heart. For people who are watching us and, maybe are a little bit afraid because they don't have the background knowledge for it, what would you say to them?
Yeah, I get that as a very common response, and it's interesting that you brought that up because people think of that as being more serious. And I hear that almost every day talking with patients beforehand about that possibility. All of this has some degree of seriousness to it, but a stent is a very important tool to use for a very important situation. Things like angioplasty, the balloon goes in, we open the artery, we take it back out. It seems like, oh, that's simpler, okay? But sometimes that's just not enough. And the technology for stents has progressed so much over the last few decades that it is an excellent tool when it's needed. And that's part of the specialty and the training and experience to make those decisions on when that's the best thing for somebody, and when we know that doing anything less than that just isn't going to be doing enough.
Can it come back, like after you have treatment, say on your right leg, can it come back on that leg? Can you develop it on the other leg? Or is it a one-time fix and then you're good to go?
Yeah, occasionally it's a one-time fix, but you're right on target with your question, and that's really right now at the almost like the battle line of treating this disease is how do we take it from treating it, improving the blood flow, and somebody, feeling good right now to that lasts for the rest of their life. And that's a real challenge. Part of the challenge is the same risk factors that cause the disease may continue, okay? So I encourage all my patients, if you're smoking, this is a great opportunity to quit smoking. By quitting smoking and opening the blood flow, you're increasing the chances of these procedures working for a very long time. Same thing with diabetes, with high blood pressure. If those are well managed after a treatment like this, increases the chance of not having a recurrence for a long time.
Okay. So this is significantly different from, say, someone who says, oh, I have discoloration in my legs, or I'm starting to see spider veins, stuff like that. That's entirely different, right?
That is a vascular problem. Okay. Rather than blood flow down the legs, that has to do with blood flow back. And it doesn't have as serious of implications as artery disease does. The risk factors are very different. Okay, oftentimes it's somebody who's been spending lots of time on their feet, okay? And in fact, physicians and nurses are at high risk for it as well. It has less in common with other serious diseases in the body. We also evaluate that and we also treat that. And that can cause very similar symptoms. There's some distinct differences, though, that during an office visit and talking about it and examining the legs, we can easily start sorting out whether it's a vein issue or an artery issue.
Okay, at this moment, I'd like to take a small break to take a look at our 23ABC Facebook feed. And I see we're getting some comments coming in. So let's take a look and see if Doctor can answer some of these viewer questions. We have one question. I'm reading it for the first time. This is from our viewer D. She says, my question is about x-rays. I had breast cancer, but I was misdiagnosed and misread. How many doctors... if I'm reading her question correctly, she's saying, how accurate can these x-rays or what you do to examine the legs be?
Yes, there's a limit to every technology. Mammography is in the screening area. That's why it's recommended at certain intervals. Any screening test has limitations because you want to find and treat early people with disease. But at the same time, if you take any screening test and you make it too strict, you can start including everybody who has a mammogram. And that's not good because you wind up telling people they may have a serious disease when they do not, and then you may wind up treating them as though they have a serious disease when they do not. So every screening test has its limitations. There are screening tests for PAD. We're going to talk more about some of those. But the X-ray that's involved in PAD is in a situation where we've worked our patients up, we know they have vascular disease, now we're finding out how severe that vascular disease and choosing the right treatment for them. So it's a little bit of a different thing with vascular problems.
Andy, to add to your comment, I have another comment coming in from Diane, and she says, "We love this doctor. He is very thorough, and he is awesome."
Well, thank you, Diane. I appreciate that.
So the healthcare that you're getting at Kern Radiology is bar none. Tell everybody a little bit about what Kern Radiology is. You guys have a very special year this year. It is your 50th birthday.
That's right.
So tell us a little bit about, for people who are out there and say, I went to another doctor and I thought this was going on and they misread, or for whatever it is. Tell everybody a little bit about what Kern Radiology is and what you guys do here in the county.
Sure. Well, as you mentioned, 50 years in Kern County. We're very proud of that fact. I think there's a couple billboards in Bakersfield celebrating that. And Kern Radiology is, at its core, it's a large group of radiologists. And we work both in the hospital system in Bakersfield at multiple hospitals. We also have outpatient imaging centers. And imaging centers are very important because they give more access to treatment. Hospitals are crowded places and they're extremely important, but imaging centers let people who are otherwise healthy walk in and walk out. Okay, so Kern Radiology has 4 imaging centers in Bakersfield in different locations throughout Bakersfield to improve access, and they perform a wide range of imaging at each of those facilities. Within the specialty of radiology is vascular and interventional radiology. So we're trained the same as radiologists up to a point. We don't then specialize in the imaging, in other words, interpreting studies with pictures. We specialize in procedures with imaging and treatment. So we become much more individually patient-focused in interacting with the patients, much like you would see with a surgeon or many other types of physicians. And so that's what makes us a little different. There are 4 of us within Kern Radiology, and we work at different facilities. 2 of our outpatient facilities have procedure rooms, and we perform all kinds of different minimally invasive procedures to treat different problems.
And one of your facilities is going to be opening the doors to the public the entire month of September. Your location
That's
at
right.
2301 Bahamas Drive. Tell us about the big event that Kern Radiology is kicking off starting September 1st.
Well, September is PAD Awareness Month, and so we wanted to take advantage of the opportunity to raise awareness for PAD throughout Kern County. And hopefully with raising that awareness, help people recognize they may have a problem seriously impacting their life they weren't even really thinking about or aware that they had. So for the month of September, Kern Radiology is providing free PAD screening. It's at our office on Bahamas Drive. You can walk in anytime during regular operating hours. You can spend about 15 or 20 minutes answering very few questions and then have a very simple test performed to see if there's a blood flow problem in the legs. Completely painless test, I promise. Very similar to if you've ever been in the hospital and they put that device on your finger that measures oxygen. Okay? And so that's what we're doing in September. We're inviting in the public and encourage people to participate. Tell your friends, your parents, relatives that you think may have problems. Another option, in addition to just walking in, is you can call and schedule an appointment.
That's right, and that number is 661-489-6666. 6350. And again, you can go in any day during the month of September, starting September 1st, Monday through Friday from 8:30 to 5:30 at 2301 Bahamas Drive. That's right near Yokitz Park. So as Doctor said, if you or someone you know maybe has questions, maybe you think it is, maybe you don't think it is, but you're having issues with your legs, come into their facility at 2301 Bahamas Drive. They're going to take care of you, check you out, and maybe by the time you're able to walk away, you're going to know whether or not you need to book an appointment with your primary care physician, who can then refer you to Kern Radiology.
Exactly. That's my home base. That's where I work every single day. So if you see me on your way in, please wave and say that you saw me on this event.
Doctor, let's talk a little bit about, for those of you who are just joining us, we are talking with Kern Radiology today about something called PAD, Peripheral Artery Disease. Earlier you mentioned that there are 4 major symptoms. For those of them who are just joining us, can you go over those symptoms again?
Sure. The first thing that people experience, so the first thing that someone may notice, is cramping in the legs with walking and the inability to walk as far as you used to. That's not always just an age problem, and it's not always arthritis. And in fact, there are many people, 10% of Americans have PAD, and there are many people who don't recognize it and go untreated. So the leg cramping with walking, that's one. And as the disease progressed, it can cause cramps in the muscle with rest. It may wake you up at night. It may require that you get up out of bed and walk around to make it feel better. The most serious of the problems is when someone with PAD develops a wound. The common situation that they'll describe to me is they were clipping their toenails, they got a little cut in the skin, and then it just wouldn't heal. And if it develops into an ulcer because of poor blood flow and inability to heal, it can become very serious. And that's what can eventually lead to amputations. And, you know, that's a scary thing to talk about, but we don't want anybody reaching that point. We don't want anybody having to have a procedure like that without recognizing the problem early, getting early treatment, and being able to avoid it.
Okay, we have another question coming in from Elizabeth, and I'm hoping that maybe you can help answer the difference between what you're doing in September and what could happen after September when this event is over. So her question is, does Kern Radiology do any screenings in the office that I can go in for, or do I need to see my doctor first?
For the month of September, you can just come in on your own. You don't need to get a referral. It's a completely free screening process. So if you have concerns, if you even kind of think in the back of your mind, I've got some of those symptoms, but you know, I'm not sure it's a vascular problem, come visit us. We're happy to meet you, ask a few questions, do a screening test, and see if that could be the problem. After the month of September, we'll be there the same as always. Now, as I said before, some people with their insurance plans, they can self-refer. And if what we're talking about today really sounds too familiar to you and sounds like something you're experiencing, makes you very suspicious, and you're able to refer yourself, please call our office. I'm happy to meet you and talk with you, and we can find out if that's the issue. So we're going to be there, and we're going to be available continuing after the month of September. We're not going anywhere.
I have another question coming in, and this one asks for a little bit of clarification between different types of medical professionals. What is the difference between vascular and interventional radiologist than a cardiologist?
Good question.
Okay.
Good question. A lot of overlap. Vascular and interventional radiologists treat peripheral vascular disease. So again, we talked about this at the beginning. Peripheral is a term meaning away from the core or away from the center, Okay, cardiologists are specialists in the heart, and when they're talking about vascular disease, they're most frequently talking about vascular disease affecting the heart and the heart muscle. When I'm talking about vascular disease and PAD, or peripheral arterial disease, we're talking about the legs and other parts of the body that are away from the heart. That's where I specialize, and that's where my training specializes.
Okay, and this next question kind of piggybacks off of that.
Okay.
How long have you been doing vascular work?
Okay. My training involved 6 years. That was internship through fellowship. During my residency, I did a full year of vascular interventional radiology. I then did a year fellowship in it. That was at Dartmouth-Hitchcock Medical Center in New Hampshire. I'm California born and raised, eventually wound up back here, and I've been in practice for 18 years now.
Okay, well, thank you for that. I hope that answered some of those questions for those of you who are thinking, you know, should I go? Who is this doctor? Where is he from? We hope that you're feeling a little more comfortable after all the information that we're getting. I want to read a follow-up question. Let me see if I have this right. Okay. I have a question coming in from, I believe it's Georgianne, and she's asking, I've just had a vein ablation done on my right leg. That has left severe pain and hypersensitivity on my leg a month later. Can you give maybe any reasons as to why that's happening? I know that's a very specific question.
Yes, I'm very familiar with that.
Okay.
And we're going a little bit outside of PAD, but that's okay.
Okay.
Because there's overlap between some of this. We're very aware of the fact that the free screening that we're providing is actually going to identify some people with these other problems. Okay. So what you were experiencing was a vein problem in your leg. You probably had swelling, particularly towards the end of the day with prolonged standing. You may have varicose veins as well, and your doctor determined that the underlying cause was a bad vein that runs on the inner thigh and down the leg, and that lets blood flow backwards. Veins shouldn't let blood flow down. They're supposed to get blood out of your legs. So there's a procedure called a vein ablation that closes that vein. And many different technologies and ways of doing this. One is laser, one is radio frequency using heat to do it. There's a few newer procedures than that. The laser and the heat-based ones can cause pain, and it can also irritate and damage nerves. So it can result in numbness, tingling, problems like that. Now that may happen for a while and may gradually improve, and completely go away. There could still be some residual, without knowing a little more of the history and how long you've had this. It's a little hard for me to say and predict. The important thing for other viewers hearing this is there's some new technologies. There is now a very good procedure to close these veins using a glue. And that is very well tolerated. It doesn't use heat, it doesn't have the risk of damaging nerves, and it can get rid of the swelling and the pain and the discomfort without what this viewer has experienced. So that's now available, and we're providing those treatments as well.
Well, thank you for answering that question. I got a chime just now from Betty saying, I wish he was my doctor. He just answered my problem.
Oh, good. Good. Well, Betty, I hope that you will talk with your primary physician or seek out a specialist and get help, because that's a problem that can be treated. It's very common. Unfortunately, there's just not a lot of information out there provided to the public like there are about some other diseases. So I'm glad for this opportunity to talk about it.
And doctor, for the month of September, if someone goes in there thinking that maybe they have PAD, and then after that initial consultation, it turns out that that's not it, can people find out maybe what other problem it could be?
Sure. The test that we're performing during the screening period is specifically focused on PAD. So that test may be negative. And what I mean by negative is it may not find that somebody has PAD, and yet you've answered yes to many of the other questions that can be caused by other problems. So we don't want anybody to leave the screening with a negative or normal result for PAD thinking everything's clear, I have no problem whatsoever. It might be a different issue. And I hope by listening to this, people will maybe get a little bit more information, a better understanding that it could be a vein problem. Okay, there's some problems outside of my specialty that can cause similar issues in the legs, nerve problems, arthritis. In a screening process, we can't specifically identify those, but we don't want anybody who felt it was important enough to come and get a screening test to walk out with a negative result and think their symptoms aren't important. And so I would encourage anybody to follow up with their primary care physician, and if it falls into another area that that we treat, or another kind of a vascular process like a vein problem, you may ultimately wind up seeing me.
Doctor, for this event in September, and again, if you're just joining us, Kern Radiology is having a Peripheral Artery Disease awareness campaign. It kicks off on September 1st, and for every day, Monday through Friday, from 8:30 in the morning until 5:30 in the afternoon, you can come into their location on Bahamas Drive and get one of these free screenings. So the question is, how old do you have to be to walk in, and what documents do people have to bring? Do they need to bring an ID? Do they need to bring anything else with them?
They don't need to bring anything, just themselves. PAD typically starts around age 50. Okay. Now, if somebody comes in and they're 48, 49 years old, we're not going to say, no, you can't have a screening done. It's possible, particularly with more of the risk factors, for symptoms to even start in the 40s. But it's less common. So we're really looking at an age group starting at 50. PAD severity and symptoms peak about age 70. Okay. Doesn't mean that people after 70 don't have it. They certainly can, but it's just a peak that we see. So those are the age groups that we're really thinking about, and if you think you have some symptoms and you fall within that age range, then we're specifically talking to you.
Doctor, who's going to be there throughout the month of September administering these screenings?
We have an excellent front office staff that will meet you when you walk in the door and welcome you to the screening process. All you have to do is just indicate that you're here for the free PAD screening, and then we have staff members who on a daily basis already talk with our patients who are coming in for other reasons. So they're very friendly and speak both English and Spanish, and they would bring you to a screening room that's more private, ask you a few questions about PAD and symptoms you may have, and then perform the blood flow test that only takes about 5 minutes.
Okay. So you sort of touched on it, but I want to know if maybe you can give the message once again. So if someone goes there during the month of September and then they test positive, what happens next? Do they continue to see you? Do they have to go back to their primary care physician? What is sort of the chain of events?
Yeah. Well, because not all insurances allow people to then seek a specialist, really in this day and age, a lot of patient care goes through the primary care. I think that's appropriate. And I think the primary care plays a very important role in care of any patient, because they're coordinating all these different things that are happening. They have a very difficult job. So what we do is we take the positive results and we write a letter and send it to their primary care physician. Okay. So you may go back to your primary care and say, hey, I had the screening, they said it was positive, but you don't need to know all the details of it. We're going to send that ahead of time.
Okay.
And it'll say, Mrs. Jones participated in a free screening. This is what we found by asking a few questions. This was the test result, and we recommend that she have a consult with a specialist and pursue this further.
Okay. I'm looking through some of our Facebook comments here, and a couple of them are saying, that the information that you're giving them is so valuable. They wish they could come see you directly. But this is where we have the open invitation. Throughout the month of September, Kern Radiology is opening their doors on their location at 2301 Bahamas Drive. You can show up Monday through Friday. You don't need anything, doesn't cost anything, it's absolutely free. From 8:30 in the morning until 5:30 in the afternoon. Show up, get one of these health screenings for PAD. Now, if you would rather sort of book an appointment and maybe save that little morning slot or the afternoon slot that you prefer, there is a phone number that you can call. It is 661-489-6350. Give them a call. Let them know that you heard it right here on 23 ABC Facebook Live. Let them know that you want to book a certain time slot and they can help you out.
Yes, and I've already had those questions. Some people, and I find that patients really do know what's going on with them. When you have a conversation and even just ask a few simple questions, so often I find the patient already knows they have a problem and may have a pretty good idea what it is. So we've already had those questions about, well, can I just skip the screening process and come in for a consult? The answer is definitely maybe, because we don't know whether or not insurance will allow it or not, but please feel free to call the same phone number that we're giving for the screening process. Our schedulers, our people who answer these phone calls are very knowledgeable. They can sort out those questions and they can see what we can do for you.
Doctor, let's talk a little bit about Kern Radiology. We've been talking about, the people that work there and the services that you provide, but truly, what makes Kern Radiology so different?
Well, I find we have excellent staff from the front office through the RTs, our nurses, all of our supporting staff, and they're friendly. They care about patients. They want to see all of the patients have a good experience. The practice, we really pride ourselves in what our patients experience, and we ask for feedback. We ask for comments because we want to improve in any way that we need to. And I'm very proud to work there. I enjoy all the people that I work with. We get to know each other. And it's an excellent group of people, and many of them teach me some Spanish too.
See.
Yes.
50 years and going strong right here in Kern County. Doctor, earlier you were talking about the different types of treatments for PAD, and I have a question here. It's coming in from Helen, and you can interpret this question a lot better than I can. She's asking, is a stent an extension towards a bypass?
No.
Okay.
A stent is a very different thing from a bypass. In fact, what I would say is a stent is an alternative to a bypass.
Okay.
The stent is placed inside of the artery, and some stents, some advanced technology stents, are made out of the same materials as the bypass graft, but inside the artery. So I've actually referred to it sometimes as a bypass inside of the artery, rather than connecting a tube from above a blockage to below a blockage. You're going straight through the blockage and opening it that way. So they're different things. They accomplish a very similar result. There's some different data on them. There's lots of studies out there comparing the two, and there's different situations where one is better than the other. And part of the job of a vascular specialist is knowing and identifying those situations. But as my specialty has advanced, and data has developed. We become more aware of the results and the long-term results. Really, these less invasive treatments have become the first line of treatment.
Okay. Doctor, I'm looking through our Facebook comments, and I have two questions I want to ask you. The first one is, for the test, for the screenings happening in September, will you need to lie down, will you need to be reclined, or be asked to do any types of exercises?
Oh, that's a good question. That's a good question, and I didn't cover that yet. The first part is just sitting, answering some questions. The second part, where we measure the blood flow, we have a chair like a recliner.
Okay.
We want to put your feet up. You don't have to lie on a stretcher for that. We may ask you, and this is according to ability, we may ask you to flex your feet several times for 30 seconds or so. And that activity helps to maximize the blood flow and get a little more precise of a blood flow measurement. Okay.
Is there anything people at home probably shouldn't be doing if they're experiencing some of the symptoms? I know a lot of people maybe have some home remedies to try and treat some of the pain happening in their legs. Are there any major don'ts?
Sure. Oh, yes, absolutely.
Big ones.
I've seen, unfortunately, some cases where with severe PAD and completely blocked arteries, I've seen a patient feel very cold in their leg and even numb and put a heating pad on it. And that's dangerous, particularly when it's numb. Because I've seen some severe burns.
Really?
Yeah. So you want to be careful with coming up with your own treatments for it. Now you might think that, well, it hurts, so I should stop walking. There's actually an old-fashioned remedy for certain types of artery blockage where their physician would prescribe walking every day until it just absolutely hurts so bad you have to stop. Okay? And by doing that, your own arteries can gradually develop and enlarge and start getting better blood flow around the blockage. Okay? What we found with time is very few people are able to tolerate that. It takes just a strong commitment and an ability to tolerate that process.
Because it's so painful.
To do that every single day and walk to the point of cramping that keeps you from walking farther. So it's tempting to think, oh, I've got some symptoms of PAD, I shouldn't do anything. Well, actually, continuing to walk as much as you can is a good thing, okay? But the particular thing to be very careful about is any wound, any cut, make sure that it heals quickly, and by quickly, a small cut, that ought to be healed up within a week. Okay? Anything deeper, of course, you probably ought to be seeing a physician already. But we don't want cuts or wounds turning into ulcers, turning into gangrene and those kind of problems.
Yeah, that's scary. Doctor, we're about a week away or so from the kickoff to this awareness campaign. If somebody wants to come and see you ahead of time, should they see their primary care physician first and be referred to you?
Are you talking for the screening or for
PAD.
A consult?
Yes, just for a consultation for the pain for the legs.
That is absolutely always an option. One of the things we hope by talking about this and providing the free screening is people get a little bit in tune with what's happening with them. And certainly if you think that this sounds like you, go ahead and talk to your primary care physician. Get the ball rolling on it. We're going to ask some of the same questions in the screening that we're talking about here, okay? So you may already be identifying with this and saying, I have that, and the other, and I think I should already be seeing a doctor, and that's just fine.
So, Doctor, remind everyone again, for those of you who are just catching the tail end of this 23ABC Facebook Live event, what is happening in September?
So in September, Kern Radiology is celebrating PAD Awareness Month. And PAD means Peripheral Artery Disease. We're focusing on artery disease affecting blood flow in the legs. So for the month of September, because of PAD Awareness Month, we're providing free PAD screenings. And that's at our office on Bahamas Drive. And you can walk in anytime. You don't have to schedule an appointment, or you can schedule an appointment if you want to. The whole process of screening takes 15 to 20 minutes. It should go pretty quick. It shouldn't keep you there very long. But we hope to find and help people experiencing these problems and help avoid any more serious problems.
Doctor, is there any message you'd like for our viewers to take away? If they get anything out of this entire conversation that we've been having, giving them the information they need, what's the #1 message you want them to know?
If you're having problems, seek help. I meet so many people who just accept the fact that they've got a problem and choose not to bring it up. Or it always amazes me if a patient apologizes about telling me about another problem they have. I encourage people, talk to me, talk to your doctor, share what's going on with you. If that was happening more often, there would already be much more awareness of PAD. So, don't miss out on that. And please, seek help and don't let things go until they become more serious.
So again, this is a free event. It kicks off September 1st. If you're interested, or maybe you've been listening to our conversation and maybe this isn't for you, but you know someone who has been complaining of some leg pain, or maybe they've got something going on and you're not quite sure what it is, the fine people at Kern Radiology are opening their doors at their location at 2301 Bahamas Drive. That's right next to Yokit's Park. It's pretty close, so there's an identifiable marker. You can't miss it. Go during their business hours, Monday through Friday, starting September 1st from 8:30 in the morning until 5:30 in the afternoon. And the screening takes 15 to 20 minutes. Dr. Isaeff has said it's absolutely free. You don't have to bring any documents with you. If you do prefer to reserve a time slot for you, I'm going to give you the phone number one more time. It is 661-489-6350. Whoever answers the phone, let them know that you saw this on 23 ABC, either on over the air with our promotional campaign, or let them know that you saw it right here on 23 ABC's Facebook Live event, that you heard Dr. Isaeff talking about this event and you'd like to book yourself a time slot to come see them and get checked out and see if it's, maybe just a little bit of pain or if it is, in fact, PAD.
Yes, absolutely.
All right, doctor, before we let you go, we have about 5 minutes left. For those people who are just joining us, again, we are talking about peripheral artery disease. Tell us again the main red flags. It has to do more with than just pain in your legs. What are the red flags for this disease?
Yes. Well, we're talking about blood flow in the legs.
Okay.
People who have cramping in the muscles when they walk, and particularly if they find that keeps them from walking as far as they used to. Okay, their activity is decreasing, and that's a real red flag. That's one of the more specific symptoms someone may experience that fits with PAD. Also, pain at rest, particularly muscle cramps in the legs waking you up at night. Also wounds on the legs or the feet that won't heal or are getting worse.
And the screening is open for everyone, but tell us again what the main age range is for people who suffer with PAD.
Yes. These symptoms can start at 50, and typically PAD peaks about 70 years old. But, please, if you're over 70, it still includes you, and we're just talking the age ranges where this is most common. Obviously, some people fall outside of those age ranges.
Sure. So that certainly shouldn't stop you from not coming in to see you, say,
Sure.
Oh, I'm only 49. It doesn't happen until you're 50, right?
Yeah.
Okay.
Yeah, and many of us are 49 for a long time.
49 plus.
Yeah.
Let's talk a little bit about treatment. People can go in, they get screened. Once they go through the process, what are some of the different options for treatment?
Okay. You'll see a specialist like me, okay? Typical office visit, have a basic exam. may have some additional, we call it diagnostic testing to confirm the problem. And then the treatment, first-line treatment in this day and age is angiography. Angiography is placing a small little catheter, small little tube in the artery in the leg, injecting X-ray dye, getting pictures of the arteries, and then seeing if it's something that we can treat using any number of small devices inside of the artery to open up the artery and blood flow. And all of this now can be done as an outpatient. In the past, this would involve hospitalization, or at the very least, going to the outpatient facility as a hospital. Our office, it's a freestanding office, all the supplies, everything available, and it's done same day. You go in the morning, you walk out by the afternoon. Makes everything very simple.
Yeah, that's easy, and it's fast. So, you know, a lot of us don't have a lot of time to squeeze in this and that, but when it comes to our health, it's so much more convenient when you have processes that don't take so long.
Yes.
All right, so again, this event kicks off on September 1st. If someone has decided, you know, I've watched this, everything the doctor says now makes sense to me, and they want to go in September 1st, is there anything that maybe they could or should be doing to maybe make the situation a little bit better before they come and see you?
What do you mean?
Well, because earlier we were talking about the don'ts, right?
Yes.
Don't put the hot heat pads on your leg.
I see.
So is there anything that maybe somebody can do to try and ease the pain until they come and see you?
Yeah. A lot of people figure out on their own what eases the pain, like cramping in the legs at night. They figure out putting the leg down or sitting up makes it better. Okay, so there's some simple things like that. Most people, by the time they see me, have figured out a lot of that already. So that's pretty simple, but it can help.
Okay, and then finally, tell everyone about the change that they need to make to their lifestyle after you've been diagnosed and treated and you go home. It doesn't just go away because you've been treated. The patient also has a responsibility, right?
Yeah. The most important thing for preventing the disease from showing up in new locations or undoing a procedure that we've just done and making that procedure successful, you know, for years and years and years to come, is to change the risk factors. And for PAD, the risk factors really can, for the most part, be modified. Things like smoking, okay, that's a choice, unfortunately, we make, and quitting smoking can make these procedures much more successful. Diabetes control, control of high blood pressure, diet, keeping cholesterol low, all of those things make a huge difference, reducing risk factors and reducing the chance for the same problems coming back.
Doctor, thank you. Okay, we are just about getting ready to wrap up our 23ABC Facebook Live event. I'd like to take this moment to invite any last-minute questions that you might have before we have to sign off and say goodbye to Dr. Shawn Isaeff with Kern Radiology. If you are just catching the tail end of this, we'd like to remind you, Kern Radiology is kicking off an incredible awareness campaign for peripheral artery disease. It starts on September 1st, and it's going to go throughout the entire month of September. So if you've been listening to our conversation and you'd like to come in and get screened, they are located at 2301 Bahamas Drive, right next to Yokuts Park. You can come on down Monday through Friday from 8:30 in the morning until 5:30 in the afternoon. The screening is absolutely free. You can come in, and it takes about 15-20 minutes. They make you do some simple exercises to sort of diagnose where you might be, and then the people at Kern Radiology will tell you exactly what comes next and what comes next in the line of your treatment. Doctor, before we sign off, is there anything you'd like to let our viewers know?
Well, we're focusing on the month of September right now, but I hope if this strikes a chord with anybody, or you start thinking about mom or dad or friends that have similar problems, we hope to raise awareness throughout Kern County and going forward, not just for the month of September. So if you have this in the back of your mind, please contact us anytime down the road.
Dr. Isaeff, it's been an absolute pleasure. Thank you so much for the wealth of information you've shared with all of Kern County, and I'm sure you're going to have a very fun but very busy month of September.
Thank you, Crystal.
For 23 ABC Facebook Live, I'm Crystal Figueroa. I'll see you next time.